I think at the beginning we start seeing in our office persons with tinnitus, but they also report kind of hyperacusis. But time to time, now we see just hyperacusis persons. I think now it's becoming a more as a topic that doctors and even patients are noticed about that. So we have to know what hyperacusis is, and we have to differentiate from other symptoms. When we say hyperacusis, we say that we have an abnormal tolerance to environmental sounds. But we have to differentiate between two other symptoms. First of all is phonophobia or misophonia, that we just have some fear to special sounds. I will remark especially what happens in musicians or in teachers. I mean, they can stand in a restaurant, they can stand in a cinema, but when they have to afford to get into a classroom or just to play in the piano, they really have problems with that, and probably they have some psychological fear to these special sounds. So we say that hyperacusis could be just an auditory disorder with some secondary activation of the limbic system and the emotional system, and phonophobia or misophonia should be a problem with the limbic system, not from the auditory system. And if we want to compare to another symptom, that is recruitment, I would say recruitment is just a phenomenon from the cochlea, and probably very typical from aggressive cochlear diseases, as sudden deafness or Meniere's disease. And it's just the way that the cells in the cochlea have a distortion of the sound, because they cannot manage really well. If just a pure hyperacusis, I will stand for acoustical desensitization. We have many options. TRT is one of these. Now there's some theories that they try to apply just the sound that is loose because of the hearing loss. So I think it could be a very good option. But we have to be careful that because if there's any phonophobia, we have to add some psychological approaches to this phonophobia.